Meanwhile, officials in Puerto Rico are struggling to test possible COVID-19 patients. This after the governor there canceled a $38 million contract to buy 1 million test kits from the mainland. The number of cases now on the island surpasses 1,100, and the island also saw the death of its youngest patient due to COVID-19. So David Begnaud has the latest on what's happening in Puerto Rico.
Anne-Marie, good morning. Those $38 million worth of tests were actually supposed to come from Australia. And the debacle that has been the ability to get more tests involved the government using a construction company that had no experience with medical supplies. So it turned into quite a scandal. At any rate, the new Secretary of Health, who just took over about 4 weeks ago, has oversaw the canceling of that. There's even some question as to whether or not the construction company in Puerto Rico that was going to purchase the tests from Australia even actually made the request. It's turned into quite a mess. But I'll tell you, the one thing that seems to be working above all on the island of Puerto Rico is social distancing and isolation. The governor of Puerto Rico, David Vazquez, was the first, before any other U.S. territory or state, to impose a very strict curfew. You can't even go outside and run. I hear Vlad talking about running around Central Park. You can't do that. You cannot go outside at all unless you're going to the grocery store, and the police are very closely monitoring people. They have written thousands of tickets. They have arrested people, and they are clamping down because what the government seems to understand is that the one thing they have not done well is secure more tests. And without more tests, you don't know how many people are really infected. We just found out within the last few days that the government's number of 1,200 positives on the island may be inflated because the government has been confusing rapid tests and PCR tests, the official tests. And here's what I mean by that. If somebody tested positive with a PCR, they go back and retest them with the rapid, but instead of counting those numbers differently, they added it on top. So it was like that one person got counted 3 times. So now that the government is trying to refigure their counting, the 1,200 positive cases may be far lower. And that is the one bit of good news that people in Puerto Rico can appreciate.
Indeed, David. The other thing I want to draw our viewers' attention to is the government program, the Paycheck Protection Plan. Is Puerto Rico prepared to deal with the pandemic if funding from the PPP program runs out?
Listen, Puerto Rico will suffer arguably more than any other state, Vlad. Puerto Rico always seems to get the short end of the stick. Remember, Puerto Rico does not have an elected representative in Congress who actually has voting power. So they are constantly trying to ask other people to help them fight on behalf of the 3.4 million Puerto Ricans, U.S. citizens who live on the island. The people of Puerto Rico are dealing with the same struggles that people in Florida and New York and California are dealing with. The systems are down. They have not gotten their stimulus check. Small business owners are trying to figure out, do I go to some place like a PayPal or other account that can generate some type of small business loan for me? That is also turning out to be a big struggle. But it's not just isolated to Puerto Rico, as you know, that's happening elsewhere.
So you've been talking to a lot of health experts on the island. You mentioned that what Puerto Rico is dealing with is what we're seeing elsewhere in the country. But I'm wondering if there are some unique issues to Puerto Rico, to being on an island, that the health experts are concerned about as they move forward with this.
Yeah, so good question, Anne-Marie. Number one, because it's kind of like after Maria, where the Puerto Ricans struggled to get supplies in. They're struggling to isolate themselves even though they are on an island. Here's what I mean by that. There were 2 cases of people who came from New York, lied about having symptoms when they came through the airport and had their temperature checked, went home, finally called a number for the Department of Health and said, I'm very sick. They wound up in the hospital and reportedly both wound up on ventilators. We have not gotten an update on their conditions, but the governor has done everything she could to literally shut down the island. She even asked the federal government to close the airspace over Puerto Rico. The government said no. But they did allow her to restrict all air travel to one airport, the airport in San Juan. So the unique struggle for them is trying to stop people coming from elsewhere who may be infected with the virus, because the governor has done everything she can to lock the island down. I mean, I'm telling you, if you think folks in the States have cabin fever, the folks in Puerto Rico have it times 5.
Yeah, and let's talk about those folks on Puerto Rico, David. I don't know if our viewers know, I'm sure they will, that you've got a very robust social media following, And in addition to the reporting that you've been doing for CBS News, you've been doing your own reporting where you have Instagram Live sessions with people who are affected by the virus in Puerto Rico or with family members here on the mainland. And I wondered if you could just share some of the stories of the folks that you're talking to on an almost daily basis, David. I'm on Instagram quite a bit like you, and there's not a moment that goes by where I don't see a pop-up that says, David Begnaud is now on Instagram Live. And I click onto your Instagram, and you're talking to just ordinary folks about what they're going through. And in the case of having faced down Hurricane Maria, what are some of the stories that you're hearing from just ordinary citizens dealing with the pandemic in Puerto Rico?
Well, Vlad, I call it the new normal town hall live on Instagram. I figure we all have some time to sit around, so let's listen to other people's stories, and I invite folks to share their own. We've heard incredible stories, such as one woman who reached out and sent us a photo saying, my father just got out, or is about to get out of the hospital. He has recovered from COVID-19. She said, I saw the heel of his foot in one of your pieces on television, and I want to share it with you here. And when I share that in the Instagram town hall, people feel a sense of community that they're not getting because they're not leaving their home. We hear from teachers, we hear from stay-at-home moms, we hear from single dads. We've talked to truck drivers on the road about to make a delivery. We've talked to people in South Korea who have told us how much better the testing is there. We've heard from young people. I talked to a 16-year-old girl yesterday about meditation who reached out, had saw one of the town halls where I was talking about how I find meditation to work for me. If it works for you, you might want to try it. And she weighed in yesterday and she said, I do it twice a day and it has literally changed my life. And I don't think she was being hyperbolic. I've always enjoyed giving people a space to be heard. And this is just simply an opportunity for people to weigh in and say, hey, here's my story. But more importantly, what I hear people say is, I'm getting so much from listening to other people's stories.
All right, thank you very much, David. Appreciate it.